Why is COVID-19 so dangerous for the elderly? While almost anyone can become infected with the new coronavirus and become ill, the older an individual is, the greater risk for serious illness and death. It's a serious thing. Worldwide, it appears that the virus kills over 13% of people over the age of 80, compared to just a little over 1% of people in their 50s and 0.3% of people in their 40s. And it keeps dropping with decreased age. Now, although age does matter, it's the person's overall health that exposes them to poorer outcomes as well as death. Immunity is key. Experts in infectious diseases all point to the body's immune system as one of the most important sources of defense, especially concerning COVID-19. The underlying factor that makes elderly people highly susceptible to severe illness is the health of their immune system. One thing to note here is that some elderly individuals have a very healthy and a very strong immune system, while some younger people do not. People in their 40s, 50s, and 60s may be at a risk for severe illness if they are immunocompromised in some way. Now, chronic illnesses and frailty, which is associated with advanced age, do matter. It's not age alone and not always immunity that make older people more susceptible to the effects of COVID-19. When multiple chronic health conditions and frailty are combined together with age and a declining immune response, this forms a worst-case scenario for experiencing severe symptoms due to the virus. This has been seen in multiple countries around the world, including China, Italy, Spain, and right here in the United States. This combination is also responsible for risk of hospitalization and the need for respiratory support through mechanical ventilation. Immunosenescence. I've studied it for years. Experts in immunology and aging have identified specific ways the immune system changes with the aging process. With increased age, the immune system decreases its ability to fight off foreign invaders like bacteria and viruses. Also, the immune system isn't as capable to reacting to microorganisms it has not encountered before. And no one here has, theoretically, we believe this, has encountered coronavirus, the new coronavirus. There are several of them. Hard lessons learned from Italy. This is very sad. Immunosenescence refers to age-related changes and declines in immune system and its ability to protect the aging individual as well as it did earlier in life. Immunosenescence and COVID-19 create a highly dangerous combination for many older adults over the age of 60 and older. The reason Italy has seen so many deaths is due to its older population, its average age, and this lethal combination of poor health, lowered immunity, age, and so on. We do have two sets of defenses. The immune system has two sets of defenses against dangerous pathogens, an army of cells called leukocytes, and they are actually the first line of defense, and antibodies and T cells. They're the backup army in the line of defense. Leukocytes attack and kill microbes within minutes to hours. They jump on it, and the others go into action, the T cells and the antibodies go into action for days later to protect the immune system. But as the body ages, it unfortunately produces fewer T cells leaving the immune system susceptible to attack by new and novel viruses. The immune system also has instructor cells that tell T cells what to strike, destroy, and kill. Again, unfortunately, as the body ages, communication between these cells diminishes and the T cells respond too little and too late. And then we have B cells. These produce antibodies. They're very important as well, but they also decline with age, making older individuals more susceptible to illness caused by viruses. Okay, cytokines. Let me talk about those for a moment. Beyond diminishing leukocytes, antibodies, T cells, instructor cells, and B cells that I just talked about, another age-related change in the immune system make older people more vulnerable to COVID-19. Cytokines are inflammatory molecules which help to regulate the immune response, go into overdrive, attack the lungs, and cause acute respiratory distress syndrome, or ARDS, ARDS for short. This has indeed, in fact, been one of the most common causes of death due to COVID-19. Acute respiratory distress syndrome caused by this inflammatory molecule. My final thoughts. We've learned a sad and difficult lesson about COVID-19 and the elderly. They are at increased risk for poor health outcomes, severe illness, and sometimes death due to immunosenescence. Their immune system is simply not strong enough to fight a virus it has never seen before. Hopefully, a vaccine will be developed before the next flu season or another outbreak that will save lives, not only everyone in general, but of older adults around the world and here in the United States. They need all the help they can get right now. My name's Dr. Jim. Thank you for your time and attention. Keep coming back for more information, and be well.